It's okay. All right, we are live. Can you tell us your name, please?
My name is Sol Ryu.
Your name is what?
Sol is my first name, and Ryu
Okay, so you.
is my last name, yes.
Okay, and tell us what you're a social worker during COVID. What does that mean?
Well, social workers do lots of things, but what my position was I was embedded in a primary care clinic, and I would get referrals from the doctors when they felt like people had emotional problems that needed to be addressed. So it could be mental illness, it could be people that were dealing with grief or stress or things like that. And that was my job as a social worker there.
And so what happened? Talk to us about, tell us your story.
Well, one day we were told we couldn't see anybody because there was a pandemic going around, and so it was really a nightmare of information, mixed information. The head of our health department said, well, kids won't get this virus because it's similar to the cold and they have immunity, and then the next day they'd be saying, you can't see anybody except on telephone, or we had to switch to medical care and emotional care through telephone, and then finally we got the computer. And it wasn't for a while, it was several months later I started getting people coming into my office because they were very upset and stressed out. And one woman came in and she said since she got vaccinated she had a migraine every single day, all day long, and she'd been back and forth to different doctors, and not a single doctor could give her anything that helped. All the things that helped with a regular migraine did not help her. And I said, wow, well, did you report the vaccine injury? Did your doctor? And she said, my doctor said it has nothing to do with the vaccine, but it started the day after I got vaccinated, so I don't believe him. Then I had a woman come in who said that she had woke up one day, like a week after she got the vaccine, I think it was 3 days after she got the vaccine. She woke up and she couldn't breathe. So she went to the ER and they diagnosed her with a heart attack. And she's like, well, I didn't have a heart attack, I just woke up and I couldn't breathe. But apparently there's a number that they show that says you've had a heart attack. And since then I've heard that it means that the muscle of your heart has been damaged. So previously that's how they would diagnose a heart attack. Well, this showed, of course, 3 days after she got the vaccine, she had muscle damage in her heart. It didn't show she had a heart attack. It showed vaccine injury, right? And so I asked her, if she had said anything to the doctor about that, and she says, oh yeah. I said, this must be, from the vaccine. And the doctor said, no, there's no relationship. And so this poor woman was going back and forth between the pulmonologist and the cardiologist. They were trying to figure out how to help her condition where she couldn't breathe, and they both kept referring her back to the other department because they couldn't find anything because it was a vaccine injury, right? And they weren't looking for that, or they were looking at traditional problems with hearts and lungs. And then another guy who had like a bypass surgery right after the vaccine, and somebody else who had another heart attack right after the vaccine, and they actually didn't connect it because they were told, I said, it's 3 days after your vaccine, oh, there's no relation. My doctor told me there's no relation. So
it's extraordinary how people are so believing in these doctors.
But also there were concerns, number one, the pressure. I mean, I didn't want to get vaccinated. I had the year before I'd gotten vaccinated because they, in the hospitals, if you don't get vaccinated, then you have to mask. So I got a flu vaccine the year before, and my naturopath said, oh my God, your body's all toxic, we have to detox you. What have you been doing? And it was from the vaccine. So I wasn't going to get vaccinated, but they would literally come to my office, a nurse would come to my office, oh, we have extra COVID vaccine serum or whatever they call it, and we noticed that you haven't been vaccinated. So how about right now? And this would be announced with everybody around, and it was so much pressure, and there was no confidentiality about who was vaccinated and who wasn't with the patients. In fact, the people at the front desk who were hired to answer the phones and make appointments were charged with going down the list of patients, and anybody who wasn't vaccinated, they were calling them and asking them to get vaccinated and trying to set up an appointment. So total breach of confidentiality and HIPAA. And when I mentioned this to my neighbor who is on the hospital, he's a commissioner for the hospital, he said, HIPAA during a pandemic? Are you crazy? So anyway, I was just
So you took it.
yeah,
The Johnson
and
Johnson.
then I had adverse effects too.
So what happened after taking Johnson Johnson?
Oh my God. I woke up, it was Friday I got vaccinated, and Tuesday I woke up and I was like, what is the matter? I'm sick, I'm drugged, what's the matter? I can't think, I can't focus, I don't have any energy. And so, I called in sick that day, but it continued. I mean, I would go to work and I couldn't get through the day without laying down on the floor and taking a nap, and I still was exhausted, and I couldn't read my computer. My eyes couldn't focus, and I couldn't remember things. So, I'd have who I was supposed to see, on my computer. I would enlarge it, which was a real pain in the butt, and nobody would help me because, when I talked to my supervisor and other people about, since I've had the vaccine, I can't see, they didn't want to have that conversation. But anyway, when I finally figured out how to enlarge it with tech support, I could see who my patient was, but I couldn't remember from the time of reading it in my office to walking into the waiting room to say, who I was going to see. And then I couldn't remember when I brought them back to my office why they were there. So anyway, I had to retire because it was unethical for me to continue. But I mean, I also have, my eyes stuff has not gotten better. And the exhaustion, I've been working what is it now? 2024. And this was in 2021. So for 3 years, I've been working with my doctor trying to figure out why I'm exhausted. And we've gone through all sorts of things. And it was discovered that I have supraventral tachycardia, which I also hear is being called POTS and is being related to long COVID. So obviously it's a vaccine injury because they're both the same thing.
Are you done with vaccinations now and no more? Are we done?
Oh, absolutely no more.
Any pandemic, future one? Any scaremongering? Any job? You will not take a vaccine?
Oh, no.
For any reason?
No, probably not. I mean, I was always hesitant, I didn't take the my doctor said, you want the pneumonia vaccine? And I said, why? Well, it will stop you from getting pneumonia, and you're in your 70s and you're likely to get pneumonia. And I said, well, I've heard pneumonia is the angel of death to older people. And she says, what? And I said, well, if you're unhealthy and you get pneumonia and you die, it's because you're unhealthy. I mean, why would I want a vaccine to keep me alive, hooked up to a machine or something? If I'm unhealthy enough to die of pneumonia, then I should be dead. And then the shingles, they wanted me to take the shingles. I was like, I don't want the shingles. So no, I've never taken vaccines. But like I said, the hospital was pretty insistent. I mean, what actually happened was I woke up one morning and I felt kind of ill. So I called in sick. So mandated going down, getting tested to see if I have COVID. And that was when it took 3 days to get the results back. So I was sitting there for 3 days, quarantined, and said, oh my God, if this test comes back positive, because I knew lots of people were getting COVID around me, I will be the first person in this hospital that was a staff person and got COVID and went to work with COVID. And I would be on the front page of the newspaper. I'm in a small town. We have a staff person at the hospital who has COVID. And I would be the first one. And I said, oh my goodness. And everybody knows I'm unvaccinated. So that was when I said, okay, if I get COVID, I want to be at least able to say that I've been vaccinated, if I'm going to be the first.
But look at the consequences of that.
Yeah, I know. It was, I wish now that I had found the support. That's what I was thinking. If I knew anybody else in the hospital who hadn't been vaccinated, I think I would have felt good about not getting vaccinated. But all I heard, like people in the I started hanging out with a group in town called Health Freedom Information, and I got all this more information about how unsafe the vaccines were, once I had the vaccine injuries. And it was so upsetting because, like, I'd go into the staff lounge and somebody go, oh, I just got vaccinated, so I have a chip in me, and and I can hear it telling me things that aren't true from the universe, or, all the things out there that we're concerned about, they would mock and make fun of. And one time I was really upset because this young girl came in. She was 13, and her teacher was asking the class how many people were going to get vaccinated because the vaccine was out for children. And she raised her hand and she goes, I am not getting vaccinated. Any company that puts asbestos and baby powder is not going to put anything in my body. And I was so proud of her, and I came out and I told one of my coworkers, and she goes, poor kid, probably her mother's listening to those conspiracy theories. And so there was like no support. And this was after I had the vaccine injury and I was struggling, and this woman, my friend, knew anyway. It's just so upsetting to be telling people, I can't see, I don't have energy to make it through the day, I can't focus, I can't remember, and they're kind of like, no, I'm talking about something else, change the subject. And I mean, plus I had all sorts of body pain, body aches, and nausea and other things, but it didn't affect my job. It just was really uncomfortable. And
well, thank you for telling your story.
Yeah.
I really appreciate it. Is there anything else you want to add to this?
Well, that there's lots of doctors out there treating this stuff, and so there's hope that we're going to figure out how to heal ourselves for those of us that didn't know.